I'm Stephen Locarnini. I'm a medical virologist from Melbourne at the Victorian Infectious Diseases Reference Laboratory and a full professor in the University of Melbourne. The paper was written by three other colleagues. It was written by, co-authored with Angelos Hatzakis from Athens and Anna Locke from Ann Arbor and D.S. Chen from Taiwan. And the four of us put together a sort of a summary position on chronic hepatitis B for where we are in 2014. And the article addressed the great strides that have been made in our understanding of the prevalence and the epidemiology of hepatitis B, the vaccination and prevention attempts against hepatitis B virus, and the exciting developments in treatment for chronic hepatitis B. But the paper also addressed the issue that even though we've made these great advances with these tools for controlling and even almost eliminating hepatitis B from certain parts of the world, we've made very slow progress in implementing these tools across the world as a whole in terms of trying to roll out a control and a treatment program. So policy was addressed as a key part of the manuscript. It's important because we have effective vaccines against hepatitis B virus, so we can prevent infections, we can prevent the complications of chronic liver disease through a persistent viral replication. We can treat the virus with 5 excellent approved treatments for hepatitis B in nucleotide analogues and in interferon, and prevent the complications of chronic infection. The reason for coming to liver transplantation which is end-stage liver disease and liver cancer, is dramatically reduced as a consequence of these implementing these effective therapies. So we now have the tools to really make enormous strides in controlling hepatitis B. The challenge now is to actually try and make sure that these tools are available to everybody on the planet. Well, yes, 30 years is a good landmark, but hepatitis B virus was discovered 50 years ago. So 2014 is a particularly important year for us in the hepatitis B area because Barry Bloomberg discovered the Australia antigen in 1964. And then in 1971, we saw the introduction of screening tools and screening tests for the blood bank people and to be able to screen donors for hepatitis B virus. And the introduction of those screening tests really resulted in a dramatic reduction of post-transfusion hepatitis B. And within the 30-year time frame that we're trying to capture, we've seen the vaccination approved in 1981 to 1984, and that was rolled out in many countries in Asia Pacific, and the treatments were approved in the mid to late 90s. So we've sort of had a steady decade by decade progress in terms of developing good assays, good vaccines and good treatments for hepatitis B. Well, I see the great strides in vaccination, for example, like the Western Pacific region, which has the largest burden of hepatitis B, have achieved the WHO sort of goal of preventing or achieving a reduction in hepatitis B prevalence in children under the age of 5 to under 1%. When you consider that many countries in the Western Pacific region have population prevalence rates in the excess of 10 to 15%, this has been a marvellous achievement, but we need to do better. We need to make it 0%. And so we need to try and improve get rid of that last 1% transmission that we're seeing in mother-to-baby transmissions in particular. The other great challenge for all of us is to, as I said, have access to all of these great tools that we've developed over the last 30 years, the diagnostic, the screening and the vaccination and the treatment tools. And in response to that, the World Health Organization has released its Global Hepatitis Program. And this Global Hepatitis Program really seeks to encourage nations to develop national action plans, a national action plan for viral hepatitis. And this is because the global disease burden studies have shown that viral hepatitis is now the ninth top 10 killer for humans, and through chronic liver disease, cirrhosis and liver cancer. The liver cancer is the fastest increasing cancer across the world. So we really have to sort of develop a global strategy by which countries can sort of use a framework to develop an approach that will actually allow these tools to be rolled out, to be implemented and funded and supported. I think that the last 30 years we've seen wonderful improvements and great achievements in the field of viral hepatitis, hepatitis B in particular, but we've still got a long way to go when treatment goals and screening programs are still very, very low. If we look at our HIV/AIDS colleagues, they're talking in 2020, the 90-90-90 rule. 90% of people are aware of their status, 90% of people are on treatment, and 90% have achieved HIV undetectability. I think this is a fantastic achievement of the various agencies working to control HIV/AIDS, but if we look at our viral hepatitis equivalent, we've not done anywhere as well as that. We've barely got less than 5% of the population aware of their status. We've got less than 5% of people involved in treatment programs. So really, I think what we have to work very hard to achieve is to improve those and lift those rates so that people can be aware of their status, be counselled and educated about what it means to have hepatitis B, and then enrol them into management and access programs for care and treatment.